How'd you sleep last night?
Actually, I didn't sleep well at all last night, and to be honest, I haven't slept well for the last week.
Yeah, you have been getting up a lot. What's going on?
Well, I get up because I need to go to the bathroom, and I get in there, and I have a difficulty starting to pee, and I actually have a hard time stopping.
Has it been painful?
Well, it has been painful. It's been like a burning, painful situation, yeah.
You haven't had any blood while you peed, have you?
Well, actually the last 3 days there has been blood in my urine, so that has kind of got my attention a little bit, but still thinking not much of it.
Have you had any pain elsewhere?
Well, now that you bring it up, you know, I have had some pain in my back, and I've had some pain in my hip, and I just kind of chalked it up to old age and kind of laughed about it.
Well, I still think you need to see a doctor.
Oh, I don't think I need to see a doctor just yet. It's not that big of a deal. I mean, I have had a hard time peeing lately, which is something kind of new, but...
And you said you had blood in the urine.
Well, that is true, and that has kind of got me thinking a little bit. But,
and difficulty starting and stopping.
Well, you are right saying all these things, but...
And hip and back pain.
Well...
And you keep waking me up at night.
Well, that I don't really care about, waking you up at night, but it's true. All those other things you mentioned are, putting them all together kind of does seem like it could be something, but maybe I ought to just wait another week or so and see how I'm feeling.
Well, I think it could be serious. I think you need to see a doctor.
Oh, well, I know you're going to nag me until I make a doctor's appointment, aren't you?
I will.
Okay, well, I'd still not go through that more than I have to, so maybe I will make a doctor's appointment.
Hi, Barry.
Well, hi, Doc Foster. How you doing today?
I'm doing pretty good. I haven't seen you for a while. You've been taking good care of yourself?
I have been taking good care of myself, but my wife has been trying to get me to come in and see you because I've had difficulty urinating.
Okay. What kind of problems have you been having exactly?
Well, I'll mention everything. I mean, there has been some blood in my urine. That's mainly what got my wife to want to make sure I come and visit with you, but I get up and have to pee a lot in the middle of the night. That's something new. It's been happening for the last week. I'll get to the bathroom and I have a hard time starting. I have a hard time stopping. It actually is a little painful urinating, kind of has a burning sensation, and I'll get back to the bed thinking I've relieved myself, and within another hour and a half, I'm back up again because I need to go to the bathroom again, or so I think.
Okay. Well, it sounds like you've got something going on, so what I'd like to do is a couple of tests. I want to do a urinalysis because you said blood in the urine. You might have an infection, possibility.
Okay.
And then I want to do, especially because you're just now turning 50.
Yes.
And that's about the age you want to keep an eye on your prostate. We're gonna check your PSA level. Do you know what that is?
Okay. Now I was going to ask you what exactly is a PSA
What
level?
it is a prostate-specific antigen, and what it's going to tell me by this blood test is if it's above a certain level, that possibly your prostate is doing some things that it shouldn't be doing.
Okay.
So what we're going to do is we're going to have Amanda come in. She's going to get the urine sample from you, have you go do that, and then she's going to draw some blood for the PSA test.
Okay.
And then I'll get the results of that back probably tomorrow, and I'll have you come back in and we'll discuss that and we'll see if we need to go any further.
Well, that sounds like a great game plan.
Okay. Well, I will have Amanda come in and see you, and then I will see you tomorrow.
Thank you, Dr. Foster. It's nice to see you.
Nice to see you again. Mr. Blevins?
Yes.
Dr. Foster has ordered some lab tests for you today, so I'm going to draw some blood to check your PSA levels.
Okay, she just did mention that, so I was expecting you to come in.
Let me get ready here.
Okay. How are you doing today?
I'm good. How are you?
Well, I'm doing okay. I'm a little nervous about these hearing results from these tests, but I know it's smart that I'm doing it.
Yes, it is. Very smart. Okay, I'm going to apply this.
Okay.
And I'm going to find a vein.
All right.
Clean this off.
Okay.
It's going to be cold.
No, that's fine.
I'm going to change my gloves real quick.
Okay. I'm going to look the other way when you do it.
Okay, that's fine.
All right.
Have you ever had your blood drawn before?
I have had it drawn before, and it's not my most favorite thing to do, but I know it needs to be done.
Right. Dr. Foster's a good doctor.
She really is. I've been seeing her for about the last 20 years. I'm really got nothing but great things to say about her.
Okay, you're going to feel a little stick.
Okay, I'm looking the other way.
Okay, I got what I needed.
Oh, I didn't feel a thing. You're really good.
Tape you up here. Mr. Blevins?
Yes.
It was nice seeing you again today.
Thank you, Amanda.
We need to get a urine analysis before you
Oh.
leave. The bathroom's on the left. There's a little specimen cup. Put your initials on the outside of it. Set it in the door, and I'll grab it as soon as you leave. And Dr. Foster will contact you tomorrow.
That sounds like a plan. I'll go do that now.
Alrighty, sounds good.
Very
Well, hello, Dr. Foster.
How you
Been
doing
looking forward to
today?
seeing you.
good. I did get the results of your test back.
Okay, I've been waiting to hear.
As far as the urinalysis, there was no sign of infection.
Okay, that's
So
good.
that was good. I am a little concerned about your PSA level.
Oh, really?
Yes. Normally the PSA is 0 to 4,
Mm-hmm.
and yours came up just a little higher than that, around 5.6.
Oh, wow.
So I want to do a couple more tests and try not to get nervous.
Okay.
The good thing is that you came in right when these symptoms started and you didn't let it go. So even if there is something that you would consider to be bad, you know, we're going to take care of it.
Okay.
Okay?
Well,
There's a couple things I want to do. I want to go ahead and do the digital rectal exam,
okay.
which was where I actually feel the prostate. Okay? It's a little embarrassing. I promise it'll be quick. It won't be painful.
Okay.
And I'm going to check for any lumps or any nodules in the prostate and to see if it's firm or if it's spongy.
Okay.
And then I also want to do a CT scan.
Oh.
Okay?
All right.
And then we're going to go ahead and do those today, if you have time.
I do have time.
Okay. We'll go ahead and get those done today, and then we will go from there. Okay?
Well,
So I'm going to have radiology come get you. You're going to go get an x-ray. I'll get that done first, and then I'll have you come back, and you'll be with me for just a few minutes, and then we'll sit down and talk again, okay? I feel that with the results of all the tests that we've done, that we have a confirmed diagnosis of stage 1 prostate cancer.
Oh, wow. Really?
Yes. Now, the good news is it's stage 1. And we can do a prostatectomy, which will remove the prostate. This will alleviate most of the urinary problems that you're having also. There's also some side effects you can have from the surgery, where you could have urinary problems from the surgery. So I have actually a whole bunch of papers here that I would like you to take home.
Okay.
And what this does is it explains the different kind of procedure that I'm going to be doing. It explains that I'm going to be doing an open, excuse me, I'll show you right here where it is. This is open surgery.
Yes.
And I just make a little incision in between the anus and the bottom of the scrotum.
Okay.
It's a little area called the perineum. So
Ah.
I'm going to make a little incision there, and we're going to take out the prostate. You are going to have a catheter in for probably 1 to 3 weeks after this surgery.
Oh.
And if we are agreeable to go ahead and do this, when the time comes, I'll have Amanda, she's my nurse.
Mhm.
She will explain all of what's going to happen before surgery, what's going to happen after surgery, and allay any fears that you may have about it.
Well, that sounds like a great idea. I'm a little bit nervous, but I know being in your hands and with you explaining everything, I'm okay with it all.
Okay, and then right here, these are some things I want you to think about. These are
Okay.
your options.
Mm.
So I want you to take this home, read this over with your wife,
Yeah.
and then if you have any questions, you feel free to call me and we'll discuss it. But since this is just in the very, very earliest stages, I really want to go ahead and get this taken care of so that you don't have any future problems.
Okay, well, that sounds like a very smart idea.
Okay, Barry, I'm going to send those home with you. And again, I'm sorry that it turned out to be, cancer, but like I said, it was really great that you got in here soon, and we're going to get this thing nipped in the bud.
All right.
Okay?
Thanks again, Doc.
All right, thank you.
All right. Hello?
Mr. Blevins,
Yes?
this is Amanda, and I'm Dr. Foster's nurse.
Well, hello, Amanda.
I am calling to tell you about your pre-op for your surgery that you have scheduled.
All right. What do I need to know?
You need to be on a clear liquid diet on the day before surgery, breakfast, lunch, and supper.
Oh, okay.
Do you know what that includes?
Yes, I do know what that includes.
Okay. You also need to drink 1 10-ounce bottle of magnesium citrate with a straw placed well back on the tongue so it doesn't taste nasty in your mouth.
Oh, okay.
You can come by the doctor's office and pick that up. You also need to shower on the evening and the morning of surgery. You need to wash head to toe twice during each shower using an antibacterial soap.
Oh, well, I didn't know that. I'm so glad you're telling me this.
And I wanted to let you know that your surgery was scheduled for 8 o'clock Thursday morning, and we're going to need you to be there at 6 a.m.
Wow. Okay, I will.
Okay, we'll see you then.
Well, thank you very much, Amanda, for calling.
Take care.
All right.
Barry?
Yes, Dr. Foster.
Hi, how are you doing today?
I'm doing pretty well.
Good. The surgery went excellent.
Right.
We're pretty confident that we got all of the cancer.
Okay.
Okay.
Good.
I do have follow-up visits scheduled. Amanda's going to talk to you about some things I want you to do once you go home. I am going to keep you here for maybe another day, maybe 2 more after that. 4 days tops.
Okay. All right.
And we're going to monitor you, and you do have a catheter in. That is going to stay in for the next 1 to 3 weeks.
Oh, I noticed I did have a catheter. Okay.
Yeah. So Amanda's going to come in and she's going to explain some things that you're going to need to do. And if you have any questions, you can ask her. And if you have any questions, you can always call me.
All right.
Okay?
Thank you very much.
All right. Are you fit? How's your pain? Are you doing okay?
You know what? I'm feeling pretty good right now, to be honest with you.
All right. Well, you just let the nurses know if you need anything.
Mr. Blevins?
Well, hello, Amanda.
How are you?
I'm doing fine, thank you.
We've been seeing each other a lot.
We have been.
I hear the surgery went well.
It did go well.
Well, I'm here to tell you about some things that are going to happen maybe when you get discharged from the hospital, what to expect, and...
Well, thank you. It'll be important to know these things, I'm sure.
You're going to need to rest, of course.
Okay.
Do not take aspirin.
Oh, okay.
Okay.
I will not.
Do not drive for 48 hours, so that means that you're going to have to ride with your wife.
Okay.
Okay. Avoid sexual activity for 2 weeks.
All right.
Prevent constipation.
Okay.
No straining, none of that. You need to know any signs of urinary tract infection, and you probably need to call Dr. Foster and get back into her and see.
Okay.
Maybe get you on some antibiotics and take care of that.
All right, that makes sense.
It's going to take several weeks to achieve urinary continence. Continence may improve for up to 12 months. You need to drink 2,000 to 3,000 milliliters of fluid daily.
I will. I like to drink a lot of water, so that shouldn't be a problem.
And since you're going to go home with your catheter, we have a list of some stuff I'll send home with you about catheter care, how to take care of it, where to get more products at, and all of that.
That'll be very useful and important information, too.
Do you have any questions for me?
No, you seem very thorough. I don't have any questions at all.
Okay. Well, I'm going to let you get back to resting, and I'll talk to you later.
Okay. Thank you very much, Amanda.